So look, this just to wrap it all up, okay? Obviously, you've had amazing demonstration from Mr. Khan. Everyone does everything very slightly differently, but it's the main principles that you need to know. I like the knee at 85 degrees of flexion with a footrest. I think the ladder is amazing if you can get a ladder. There it is. That's the 4 fingers breadth below the joint line. I like to use the Langenbecks to do the dissection. That is your pes bursa. There is your gracilis. I like to use the Leahy as well. I use the Leahy a lot. This is a 4-strand semi-T, so we're preserving gracilis here. What we're doing here is bringing out the semi-T. Now what I do, so you've just seen there, I'm just going to rewind that. That is actually one of the vinculi there. So let's just do that and then pause it. So here, there's a vinculum there. That's a vinculum. So I started off cutting the vinculi, but what I do now is try and incorporate them into the actual tendon stripper, so you don't actually cut it at all. I like to use nylon tape. That gives you control. You don't have to plug your fingers up. Now I use the Leahy almost as a tendon stripper. It goes down, and that gives you, that breaks down any vinculi. It's a blunt dissector, if you like. This is your tendon stripper. We're going to incorporate all the vinculi in the tendon stripper, make sure that the jaws close. Now we're going to push with our chest down, giving a little bit of give into the left hand as we're just releasing the tension. And we need to make sure we're going towards the groin. And once we've got that, there's your tendon coming out. Okay? Now these are the bands. We're just releasing the tibial ends of the bands. Now you can see here they are. There's one vinculum, there's another, and we didn't cut them. We incorporated them, okay? Now we cut them. That one we incorporate. Now you want, for a 4-strand semi-T, you want about 26, 27 centimeters of length. We've left the gracilis. That helps the hamstring post-op rehab. We're then going to prepare the graft with a double strand initially. So this is a variable loop. You prep the double strand. So there's your double strand. And then what you're going to do is bring that strand through the other limbs, and you're going to tie it to the top of the loop. And then you're going to do 3 circumferential sutures. 2 at the tibial end, 1 at the femoral end. You'll have to learn how to do those. They're not hard, but you just need a bit of practice, really. So these are now you've got a 4-strand semi-T, and I think this one was 9 mils, something like that. Anyway, maybe 8.5. We put them in a compression tube, and we're now tensioning it at 80 newtons with a bag swab. Okay, so there's your graft prepped. You can argue for a diagnostic arthroscopy before taking your tendon, okay? Some people do, and I think it's very reasonable. Mind you, if you've got a grade 3 privet with a grade 3 Lachman's, I think you're going to do it. Okay? So here's lax ACL. Now, your ideal tunnel, choose where it is, but I agree, the same kind of position, really, okay? So there is the back. Let me just pause. That's the back of our notch. This is we don't talk about clock positions anymore, but here's 12 o'clock, here's 9 o'clock, here's about 9:30, 10 o'clock. This is the arcuate ridge here, and this is the residence ridge. Okay, so you want to be at the back with the knee at 90 degrees of flexion, which is actually a proximal position. You use a chondral pick, mark your point, shave it away a little bit. Hyperflex the knee. Now, I actually use a 4.5 solid drill bit, but I'll show you an offset guide in a minute. But you see how hyperflex the knee is? This is about as far as it could go. So this takes a step out, but it does need a little bit of practice. Or you can use this offset drill guide. Okay, you're going to put the wire in. You're going to ream to 20, 25, something like that. That's the back of the tunnel now. I made a little boo-boo here by forgetting to do the depth gauge before I put the suture through. It didn't matter. So you've got to measure the tunnel. 9 mm reamer. As I said, you want to go to about 20 mil depth, 20 to 25 mils. Ensure the knee's hyperflexed. Clear the debris. Now you're going to put the suture through as you did on the sore bones. Hold it with a cocker. Here's your tibial tunnel. Try not to shave too much fat pad, but you do need to see what you're doing. Now you can use different landmarks, as I said, okay? I'm more and more using the posterior horn, the anterior lateral meniscus posterior edge. This thing here. You'll see it in a minute. Around this area, okay? Now you can't go too anterior because then you'll get impingement, okay? But here it is. There's the posterior edge of the anterior horn. I'm going to set your thing to, let's say, 55, something like that, 50, 55. Make sure that your aimer is, so that's an elbow aimer. You're going to set your elbow aimer behind. There it is. Feed the wire through. Wire coming through. Just bang the wire in a bit more so that you've got it, and then hold it with a clip. Over-ream with a 4.5, or you can go straight for your 9 if you're happy with your tunnel position. Use slow reaming speeds, especially in kids. Stop, start ream. Don't burst through. Use slow ream at the end. Over-ream with a 9mm reamer. Right, 9mm reamer. Through. Now you're going to mark your graft. Now this is an adjustable loop, so you want to mark the length of the tunnel on the adjustable loop from the bottom of the button, the length you want of the graft to go in, which is about 20 mils in the femur. You're going to pass the sutures of the loop as you did on your sore bones. You can see, you can just see this is looking from the medial portal. I was looking for the medial portal, so you see the buttons flipped. Now with the adjustable loop, you're going to pull it in by pulling on the two, as you did. I think some of you did the adjustable loop. I use a swab because this really cuts through your fingers and it just gives you nice control. Okay, you don't want to pull too hard because you want that extra little bit of give for the end. Cycle it, whatever, 10, 20 times. Be careful if you've repaired a meniscus because you can actually damage your repair. Do it too vigorously. Now you've got the tibial end. So this is a double suspensory. So at the tibial end, you put a button, a bit like the ender button on the other side, past the trocar, so that just helps manage your sutures a little bit and tension them. And then you're going to pull the button, you're going to tension the button, get rid of the trocar, and then you're going to sit it down on the tibia, very loosely at 90 degrees. Then you're going to extend the knee, tension it, this double suspensory, I tension at full extension, tension the tibia, retension the femur because you're pulling that extra little bit into the tunnel, retension the tibia, and then you just tie. You don't have to tie these, but it's quite good too. And this is the bit that the graft was attached to, so you can tie those as well. Got everything. You can't do much at this stage, but you just for your own satisfaction, you can do or you need to cut the other side. And just for your own satisfaction, you do a Lachman, an anterior draw, and done. Okay, so those are your steps. We'll put them, they're on the website as well.